Everyone, it's Lisa here with Hope for Us CD and have another video. And today we're going to talk about pain relief through the use of heat. So although pain relief through heat has not actually been widely studied in the world of sickle cell, little side note, I am working with some doctors and biologists nationwide to get a study like that off the ground, so I'll let you know how that goes. But although it hasn't actually been technically studied, it is a common conversation in the world of sickle cell that we all use heat as a first line of defense for when pain's coming. So this might be like a mild pain crisis, or people living with sickle cell tend to frequently report almost a sixth sense when they start to feel a pain crisis coming on. So trying to ward one off before it turns into a full-blown ER level pain crisis, the use of heat seems to work really, really well. So we're going to give you some options and talk about the different types of heat. So the theory surrounding heat and the pain that we here in the world of sickle cell experience, which is due to the blockages, is that heat does expand the blood vessels. And so in theory, by expanding the blood vessels, you're opening it up a little bit further, and that partial blockage can dissipate, or that full blockage can break up a little bit more because it has some wiggle room. Think about when you have a blocked pipe, and if you can open up things a little bit further, then you can unclog the pipe. Similar to that. So let's talk about the two different types of heat. So there is wet heat, which is the wet part of the heat is activated through moisture on your skin. And then the dry heat, which might require some moisture, but it's not actually touching your skin. So I'll give you that ahead of time. So in the world of wet heat, the most common that people report using, and we use this frequently with Thea, this is my awesome prop for a bathtub. My little guy taking a bubble bath. In my world, it's always a bubble bath, but in yours it doesn't have to be. The nice part about wet heat is that it's fast acting. So especially when you're able to immerse the part of your body that's in pain or it feels like it's about to be in pain in a nice hot body of water, is that it acts really quickly. So it's able to penetrate through the skin and open up those blood vessels really quickly. It's also fairly inexpensive because as long as you have access to water and a way to heat it up, then you're good to go. The downside is that it cools quickly. This happens to me frequently when I try to take a bath, but if you need that real hot moisture, it does dissipate much faster than if you're using the dry heat. That also, side note, really importantly, will mean that your skin will be cooling as well, which for some people, Thea included, can actually trigger an even more intense pain crisis. So be sensitive to your body, and if temperature shifts are really bad for you, then pay attention to be mindful of the temperature of the room you're in when using wet heat. So one of the things that we do is we use as hot of water as we can with the door shut when we fill up the bathtub so that the whole room gets nice and steamy so the room itself is warm. Then cool it off just a little bit so it's not scalding. Thea gets in, and then she can soak in a really hot room so that when she's getting out, she doesn't then get sent into a pain crisis, which would only just further complicate things. So first option, bath. Second option would be a wet washcloth. They like to call this fancy term warm compress. Using really nice hot water and then microwaving it gets it even hotter, depending on how hot you can stand it. The nice part about these is that they mold to different parts of your body, even around a finger if you need it. These do tend to cool off very quickly. Something that holds a little bit more heat, and you might not have around your house, but some people do, is gauze. We happen to have gauze for some other kiddos in our house, and this holds the heat really well when moistened and microwaved. This also can get into those really tiny areas of pain. People report pain in any part of their body, and some of those hard to reach areas like the tips of the fingers or the ears can be reached with a little bit of gauze. All of those are considered wet heat because the moisture is actually touching your skin. Now we'll move on to dry heat. The first thing that we use this a lot in our world, especially for you parents out there that are looking for something to be able to send your child to school with, we use these all the time. I refer to this as a hot pack. These are ones that Sean and I actually made for Sophia, but you can find them pretty readily available. A lot of times you'll see these with rice in them. They might smell like lavender. Fia doesn't like that smell because she uses this so much that the lavender is a little bit overpowering. But the ones that we made have pinto beans in them because they tend to hold the heat a little better. And all you do with these is you microwave it for 30 to 45 seconds, and then you can put it anywhere on the child's skin, or anyone. We use it as well, on your skin, and it can mold. And it does hold the heat really well because it's considered dry, meaning that the moisture is not touching your skin. This is also easily portable, can be used anywhere. Like I can use it on the plane, at school, at work, anywhere where I might experience a pain crisis, and I don't have to stop everything to go, take a hot bath. Another thing that works really well is good old-fashioned hot water bottle. So this is like a 1950s version, the kind that people used to put at the foot of the bed when it was cold outside to keep things toasty. But these work really well for that abdomen back area of pain, and also on the back of your legs. So you can fill this with extra hot water, and because it's in the plastic, it really retains that heat well. And a lot of people will use things like this if they're trying to do a pain med heat combo where they're trying to go to sleep and they don't want to leave the heating pad on. A lot of you out there talk about using the heating pad. We have found that this good old-fashioned hot water bottle works a little bit better if you're trying to sleep the pain off, because it will hold the heat in, whereas the heating pad will shut off, and then you don't have any heat. Another thing that sounds a little bit odd, but I have seen it work myself, is, you've guessed it, a diaper. So if you fill this up with water and you put it in the microwave, you can mold this to different parts of your body that are harder to get heat to. So something like your shoulder, your stomach, back where your kidneys are, your kneecap, your hip, all those areas that are a little bit harder to actually get some real direct heat on. This diaper works really well. I had another parent tell me about this at the hospital a couple months ago, and I have found it to be super helpful for those kind of awkward locations of heat. So those are my ideas. I'd love to hear some of yours. Check us out on the web at hopeforscd.org and post any comments or questions below. See you next week.